I really want you to put a timer on to see if I can explain Medicare for all in the simplest form in 5 minutes because it's so essential. Hi everyone, my name is Ashley and I am here to help Millennial and Gen Zs understand politics and the race to the presidential election as simple and as entertaining as possible. Okay, the big issue. What does Medicare for all really mean? Because these Democrats, lo and behold, they not telling you the full truth. And last thing I heard, if you don't tell the full truth, it's a lie. They're out here lying to the people. So if you need to, share this with your aunties, your uncles, your parents, your grandparents, whoever you need to, your neighbors, so that we have as basic as I can explain it, what Medicare for all really means. Okay. If you have health insurance, it can either come from the government or your employer. For me, I have insurance from my employer. And while they pay most of it, I still pay a small portion of, I think it's a deductible on my insurance every month. Let's say under the healthcare system that we have now, not only do I pay that a month, but I have co-pays and there's premiums and there's deductibles. All this goes into if you go visit the doctor or the dentist or the eye doctor. There's still other fees associated with it. So not only do you pay it a month, but you also pay it whenever you go. The money you pay a month is a tax. You are already being taxed for it. So there's the healthcare insurance people, your employer that's paying for it, the middleman, and you. Under the new Medicare for all issue, most Democrats are saying that this isn't the best option for most Americans because it would kick them off the healthcare plan that they like now. However, if you truly think about it, you don't really get to choose any doctor that you want. You have doctors that are in network and that are out of network. In network is cheaper than out of network. So then you cut the amount of doctors that there are, essentially, let's just say, in half. So now you can choose from any of those doctors in this plan. So automatically you don't have full choice to all the doctors in your city. You have a choice of just the doctors in your network unless you want to pay more for out-of-network doctors. So essentially, under healthcare for all, that would all be gone. And technically, you would be kicked off the insurance plan you have, but instead now you get more choice because now those doctors that were in network and those doctors that were out of network are all open for grabs. And they always feed into the idea that you're getting what you have stripped away. You're losing your choice. But in actuality, to begin with, you already had people limiting your choice. Second is that you will pay more taxes. That scares people a lot. Let me tell you, you're already paying more taxes. If you have health insurance, you're already paying that tax. What you pay a month is a tax. And then every time you go to the doctor, you're also paying that tax plus more. Under Medicare for all, what he's saying is he's getting rid of the tax that you're paying towards the middleman, the money that comes out of your account already for health insurance. He's taking that out. And he also is taking out, when you go to the doctor, you don't have to pay money to go to the doctor. You don't have to pay money to go to the ER. You never have to worry about signing the form and them asking, how are you going to pay for this? You don't have to worry about that. If you don't have insurance, you also don't have to worry about that. It's a big issue for people. If you don't have insurance, they have you fill out those forms and they ask you, how are you going to pay for this? Instead of getting a bill sent to your house, the government pays for it. However, that means your taxes, like the taxes, not the middleman taxes, just your taxes are going to increase some. However, you have to realize, unless you make more than $250,000 a year, you will not see a huge increase in your taxes. You just won't do it because you're not making enough money to have a huge increase in taxes. Let's say you're paying $10,000 a year for you and your family to go to the doctor. So you're getting it automatically taken out of your account, and for all the fees that you have to do to go see the doctor. And we have to realize when you go see the doctor, sometimes it's just paying the copay, then paying for prescriptions, and then paying for having a baby, paying for those special treatments or anything that you need. You are paying for those things. Your insurance is paying for a large part, but you're still paying for part of it. Now, under Healthcare for All, you won't be paying for any of that. You won't be paying for any of that. So that $10,000 that you would pay a year for everything, now you would be paying $6,500. So it's like it took away all the fees that you would have to pay, and now you're just paying the taxes. And I think when people hear they're going to be taxed more, they get scared, because essentially what it's doing is, under Healthcare for All without the taxes, you would be paying $0. But we need a way to cover the cost for it. So you would just be paying $6,500 in taxes. But what you have to realize is that you're paying $10,000 already. Now you're just going to be paying $6,500. So you're still saving money in the end. So don't let it be fooled and be like you're going to be taxed more. No, they're eliminating taxes. They're eliminating copays. They're eliminating prescription costs. They're eliminating any out-of-pocket money that you will ever have to pay to go to the doctor. You never have to pull out your credit card to pay for the doctor or pay for a prescription. It will just come out in taxes, but less than what you're paying for already. Those are two things I wanted to get out. That you will have more choice for the doctor that you go see, and you will be taxed, but you won't have to pay to go to the doctor. That's as simple as I get it and can break it down for you. If you have any questions or you just want to clarify or change things up, leave a comment down in the section below. Don't forget to like, comment, and share this video with as many people as possible. If you know, or elderly people, Medicare for All is in their advantage because all those doctor visits are now going to be free. That prescription is going to be free, and a lot of them are living off Social Security, and you will not be taxed heavily on your Social Security. If you are suffering from people who have like cancer and things like that and have large and then go into debt because they cannot pay for it, will no longer be a thing. Share this with people. Let people know that Medicare for All is not as scary as so-called moderate Democrats are portraying it to be. All right, see you in the next one.